Dr. McCann here, and this video is going to be a short discussion on the 5 most popular weight reduction programs. So the first is going to be intermittent fasting. So there are multiple different plans for intermittent fasting, but overall they all encompass not eating for a period of time followed by normal or an excessive amount of eating. The fasting works by making your body use fat for energy instead of glucose, and some call this the metabolic switch. Again, there are multiple different methods, but some of the more popular include alternate day fasting, 5-2 intermittent fasting where you don't eat for 2 days a week, and then time restricted feeding. Now, studies don't show a huge improvement in weight loss, so an average is about 15 to 20 pounds of weight overall, but it can decrease inflammation in your body and it can improve cardiometabolic function. The second diet we're going to cover is ketosis. So when you take in a very small amount of carbs a day, again, your body breaks down the fat for energy. The carb amount can vary in some people, but generally everybody is in ketosis if you get under 20 grams of carbs a day. Some people can get 30 or 40, but if you're not in ketosis at 30 and 40, you can get in ketosis under 20 grams a day. This is a very effective form of weight loss and can improve cardiometabolic function, and it is also useful for certain medical conditions like type 2 diabetes, PCOS, and it's being studied for epilepsy. Possible adverse events include nutritional deficiencies, digestive issues like constipation and kidney stones, and potentially increase heart disease if you take in a lot of saturated fat. Generally, the macros for ketosis include 55 to 65% fat, 30 to 35% protein, and 5 to 10% carbs. The problem with this is that it can be very hard to adhere to, and you can't just kind of do ketosis. Either you're in ketosis or you're not in ketosis. And if you're not in ketosis and you're taking in that much fat a day, you're actually going to gain weight. So again, your body is going to use the fat for energy if you're in ketosis, but if you're not, that fat's just going to be added to your body. The next is the Mediterranean diet, and this is more of a lifestyle change than an actual diet. So the diet originally came about by doctors noticing that heart disease was not as common in the Mediterranean countries as it is in the US. The entire diet is based on eating healthy fats, which studies do suggest can lower cholesterol and help prevent heart disease. Some of these foods include salmon and tuna, vegetables, nuts, and low-fat dairy. Olive oil is a staple of the diet, and red wine is also consumed. As far as weight loss goes, you might not actually lose a lot of weight on this diet. If you're taking in less calories than you were before you started this lifestyle, then you may lose some weight. But this is aimed more at heart health than it is for actual weight loss. Next, we have the very low calorie diet. In this diet, you get between 600 and 800 calories a day, and this should be done under a doctor's supervision with labs and an EKG checked first. And there are different plans that offer the very low calorie diet to ensure that you get all of your nutrients you need while you're having such a significant caloric restriction. This has very effective weight loss. You generally do it for 12 to 14 weeks and have a significant amount of weight loss. Now, the downside is it can be very hard to adhere to, and you can't really cheat on this diet. The first few weeks you can feel actually pretty bad, including having fatigue, headaches, you can't sleep, you have no energy. You can also have skin changes and hair loss. And then finally, we have the low calorie diet, and this is a calorie restriction. In women specifically, it's taken in around 1,200 calories a day, and all of your calories and macronutrients are based on your specific body composition, and that tells us how much calories you need and divides that into your macros, including your protein, your fat, and your carbs. And this is the method that I choose to use in my own clinic. I find that it is a effective lifestyle change, and it helps to be able to keep the weight off after you lose it. The downside is that it does take longer to lose weight. So you're not gonna lose weight as quickly as you do the very low calorie diet, but you feel better when you do it. And generally it's easier to maintain when you learn how to keep the weight off while you're losing.